libido problems in a couple. Sometimes one has much more libido than the other one. So sometimes the question is, who is to blame? The one with too much or the one with not enough? So what do you tell patients?
Okay, so I have put a lot of thought into this too. And the problem with this question in the first place, whoever asked this, is that this question is who is to blame? So that's the problem, because it shouldn't be a situation where one person is to blame, where one person is somehow deficient. So the fact that someone asked this, that they're looking to put blame on the other person in a couple, indicates a serious communication problem with the couple. And I think when there is a mismatch in libido, which is super, super common, because both men and women will have a natural decrease in libido as they get older. And I know I see a lot of couples where, like, so I'll see a woman where the husband has been on therapy, of course, and is on a lot of testosterone. And then she comes, so I can't keep up. He wants to have sex every day. It's painful. I have, vaginal dryness and all these different menopausal symptoms. So anyway, the goal is not to blame each other, but to try to figure out how you can meet in the middle and have a healthy, happy, satisfying sex life. So certainly, I mean, I think in a relationship, the sex is the glue. And of course, sex is not enough to sustain a relationship, but sex is important. And it's so easy to have sex in your 20s and in your 30s. And when we get older and people have medical problems and different psychological things, you start to go, for women, you start to become perimenopausal. So definitely you can work on restoring the libido, but you have to never forget that the most important, powerful sex organ is the brain. And you can be on all the hormones in the world, but if you're in an unhappy relationship, you may not want to have sex, or you may not want to have sex with your partner. Maybe you want to have sex with someone else. And so those are the things that really need to be worked out.
Sure. So in a good couple that's not looking to blame one each other, how do you solve these problems if one is not interested in sex anymore and the other is too much, too often maybe?
Well, when in my patients, because at the Medical Health Institute, I primarily take care of women, but actually in my other practice at CAN, I primarily take care of men. It's pretty funny. So I mean, I give women a lot of testosterone, and just again, like, the brain is so important, and it's not that sex drive and testosterone have this perfect correlation, but certainly hormones are important. And if a woman is menopausal or perimenopausal and doesn't have enough hormones, so if the estrogen is low, you're going to have vaginal dryness. It can be painful to have sex. And then if the testosterone is low, you can be not interested. So restoring a healthy hormone balance is key. But again, you have to communicate and set realistic expectations. Like, in your 50s, it may not be realistic to have sex every day, and you have to communicate and figure that out.
Yeah, sure.